Can people with straight legs develop bow legs as they age?
Yes, it's this. For now. Can they? Yes, they can. Technically they can, but in most cases they don't. When we talk about straight legs and bow legs, it refers to the shape of the bones, which is basically the form determined by bone structure. But aside from bone shape, if the joints change significantly, bowing can occur, even if the bone shape stays the same. So people with straight legs have a load-bearing axis that passes down in a good position, so the risk of developing arthritis is lower. That means straight legs are more likely to be maintained. However, in a very small number of cases, the leg joints can become damaged, even if the leg alignment is good. Then, if one side is damaged, the cartilage in that joint can wear down. As the cartilage wears, the joint space that used to be this wide becomes narrower on one side. When that space decreases, one side shortens in overall alignment, so it can feel like bow legs have developed. The bone shape itself never changes. But as you age, if it feels like your legs are becoming more bow-shaped or bow legs seem to be worsening, when you notice these changes, you should consider whether there may be a joint problem and get it checked. In the past, when we talked about knee surgery, it basically meant joint replacement surgery. Joint replacement surgery, arthroscopy, osteotomy. A very long time ago, doctors would clean the joint using arthroscopy and keep managing it that way until it was time for joint replacement surgery. But now, because osteotomy techniques have advanced, there is an option in between, so you don't have to go that far. That's why with osteotomy, if there are clear signs that the joint has started to deteriorate, it's better to do it as early as possible before the joint becomes damaged.
Is it impossible to lengthen more than 7 centimeters in the tibia with the PRECICE procedure?
Yes. I think this is a reasonable conclusion for now. Among the patients I operated on, one person reached 8 centimeters. There are also a few who exceeded 7 centimeters, but in my view, these are very exceptional cases. They had unusually excellent natural muscle flexibility, so it was only possible in rare situations. Just because some people achieved it doesn't mean it should be considered generally possible. For most people, it's not feasible. Typically, when lengthening the tibia with internal fixation, the maximum is considered to be about 5 centimeters on average. The reason is we develop something called ballerina foot. Since the muscles at the back of the calf strongly pull the lower leg, you need stretching that resists this force, but using only arm strength is not enough, since the muscle resistance becomes very strong. So in most cases, to do this effectively, you need to apply your body weight by standing. With external fixation, standing weight bearing is possible, but with currently available internal devices, that isn't possible yet. Because you can't apply pressure while standing, it's difficult to perform toe standing exercises effectively, and as a result, around 5 centimeters, most people reach their limit. However, in my case, I set the limit at 6 centimeters. The reason I set the limit at 6 centimeters is that during surgery, the calf muscles are able to lengthen well, and proper stretching is achieved while also preventing excessive pressure on the joint. As part of that process, we release the posterior structures to some extent, which is why we can usually go up to about 6 centimeters. However, 7 centimeters is not feasible for most patients.
If a smaller amount is lengthened in the femur, does the recovery period become shorter?
Yes. Naturally, the duration becomes shorter because a smaller lengthening means a shorter lengthening period, and the time for the newly formed bone to consolidate is also relatively shorter. So yes, the total time decreases, but not proportionally. Using the femur as an example, if we lengthen about 6 centimeters from the day of surgery until bone consolidation, we estimate an average of about 4 months. But if we lengthen 4 centimeters, you might expect the time to decrease by 1/3, but it does not decrease proportionally to that extent. So you can think of it as roughly similar or slightly shorter. That's a reasonable way to understand it. In some cases, there are patients whose recovery is truly faster. For example, after lengthening 3.5 to 4 centimeters, there are cases where everything completes in about 2.5 months. Cases like that are quite remarkable because when we treat a typical fracture and fix the bone, it takes about 4 months for the femur to heal. That's just a fracture healing in its original position. Yet, we can lengthen 6 centimeters in roughly the same 4-month period. That in itself is quite remarkable. It shows how much blood supply the body sends during the limb lengthening process. So overall, compared to the amount of bone we generate, the treatment period is relatively short for femur lengthening. And while shorter lengthening does reduce the treatment duration, it does not shorten in direct proportion. You can think of it like that.
You mentioned that some patients had a very short recovery period. What factors or physical traits helped them recover so quickly?
I don't really know. There must be something though. I've actually been curious about this since my residency, but I haven't conducted research on it in depth yet. But if this is researched properly, it could even lead to a game-changing bone product.